Okay, let's mix this epi drip. So whenever we do epi drips, we don't get to do them a lot, so we need to make sure that we're practiced up on them, that we have a plan for how we're going to do them. That plan most of the time comes back for a lot of people to looking at a chart in your protocol book or on your phone or something. No problem with a chart, except that sometimes this isn't very fast and you don't do this a lot. So if we can make it very simple, that's what we're going to do. So just to show you the chart way to do it, the chart wants you to mix your epi 4 to 1. And what do they really mean whenever they say 4 to 1? Is they're saying 4 micrograms per milliliter, so 4 to 1. And that's how they're wanting you to mix it up. So if I was going to mix it 4 to 1, I take a 250 milliliter bag of normal saline. I add into it 1 milligram of epi, 1 to 1,000. And now my concentration is 4 mics per milliliter. And I know that I'm going to get 1 microgram per minute per. That took a lot of math to figure that out. And if you don't do this dose calc math every day, it's not something you're going to be able to figure out very easily. So let's look at a little bit easier way, I think anyway, to do this and get it done. So my big deal with mixing drips, if I can get it to a 1 to 1 or a 2 to 1, the math is going to be super easy. So on every ambulance, we have 1 liter normal salines. On every ambulance, we have 1 to 1,000 epis. And we have 10 drop sets. So I'm going to add a 10 drop on here. And then we all have sick patients. And they get IVs. So we have all these things. So put 1 milligram of epi inside of that 1 liter bag. Whenever we do that, we have 1,000 milliliters and we have 1 milligram. So our yield on this is 1 microgram per milliliter. Really easy math, and every ambulance that you work on has all of these things. So we're going to use a 10 drop set, and my dose range for epi is 2 to 10 mics per minute. So if I want to do a good start in the middle range, I do 1 drop per second. 1 drop per second, obviously, drops per minute. And 60 drops per minute will give me 6 milliliters because that's a 10 drop set. So 10 drop set means 10 drops from this is 1 milliliter. So 60 drops divided by 10 is 6. So 6 milliliters. So if I get 6 milliliters and I know this is my yield, I will get 6 micrograms. So I'm right in the middle of this 2 to 10 range. If I need to go up a little bit, I can go up a little bit. If I need to go down a little bit, I can go down a little bit. We just need to make sure that whenever we do this, we mark this bag epi and make sure nobody flushes it. Make sure that the roller ball clip that's here, you put a big piece of tape over and you write epi on it. You don't let anybody think it's just normal saline. Make sure you're marking it with a Sharpie. Make sure you're taping the roller ball closed, that kind of thing. Whenever I use this, it's post-cardiac arrest patients. It's in the house. I don't have my dopamine with me. I don't have 60 drop sets. I just need to mix something up really quick. So I mix up this 1 to 1, dirty epi drip, whatever you want to call it, and get it out to the patient really quick so that we can perfuse on the way to the ambulance before we can hang on more long-acting drug. Or we'll keep this one if it's working for us once we're on the way. Anything you can get it to 1 to 1 or 2 to 1 is going to help you out in the long run. So hopefully this helps you just a little bit. This is also pretty handy for anaphylactic patients. So if you go to an anaphylaxis, you give them some IM epi and they rebound on you and it doesn't hold them, you can start them on an epi drip, and this is the easiest way to get that epi to them IV the fastest, is to make it 1 to 1 with the epi drip and you hang it like this. So I hope it helped. So the big new drip drug in EMS in the last couple of years is Levophed or norepinephrine. It's replacing dopamine. Their patients are doing better in the long run, so it's something we really need to be embracing and using a lot. So with Levophed in the field, they're going to, the textbook way to mix it is to put 4 milligrams in a 250 bag and figure your math down from there on a 60 drop set. The problem is it's a little bit complicated and the math gets kind of tough. So if I can always get you back to a 1 to 1 or a 2 to 1, you're going to be fine. So with Levophed, my deal is 1 liter normal saline, 10 drop set, sick patient, hook them up. I'm going to add in here 2 milligrams of Levo. And you can add in 1 milligram. It's just going to water it down a little more. It's no big deal. You're just going to get more fluid to your patient. It's a little bit, you have to count more drips, basically. More drops as you get a little bit higher dosing. So, and I start them off at 1 drop per second. And that 1 drop per second, because my yield in my bag now is 2 micrograms per milliliter. My 1 drop per second is going to give me 12 mics. Most protocols are 2 to 20 mics, so that puts you right in the middle. Now you can go up or go down, and figure your math backwards, basically. So figure out where you need to be now. But what these things do with epinephrine and this gives you a good starting point. So they've got low blood pressure right now. This is a good quick way to mix it up and to get this going on the patient right now, to buy you time so that you can do your math, or you can consult, one of your protocol sheets or your cheat sheets, whatever you got to do. But this is a way to get the medicine to the patient now, because the longer we delay that, the worse off the patient's going to be. So something else I wanted to give you with epinephrine is maybe it's kind of getting popular now. It's called a push dose pressor. You may have seen this used a lot in surgery. It hasn't really made its way into being studied in EMS and the ER yet, but in surgery it's been used for years. And it is applicable. So it is the same as an epinephrine drip, except you're mixing it up in a syringe. Whenever I use these, we got patient post-cardiac arrest in the house. All of my drip supplies are out in the ambulance, but the patient has a low blood pressure now. I always have a flush on me. I always have epinephrine in my bag, no matter what company it is that you're working for. So you get this flush out, and this flush syringe, not drawn to scale. Okay, yeah, don't pay attention to that. So it's a 10 milliliter flush. I'm going to push out 1 milliliter. So I'm going to leave 9 milliliters inside of this flush. And then I'm going to add in, and this is very important that you pay attention to this, epi 1 milliliter of 1 to 10,000. I need it to be cardiac epi, not a bullet. If it comes out of a 1-to-1 bullet, it's going to be too concentrated. But whenever I put that 1 milliliter into here, we'll have 10 milliliters total again. My yield will be 10 mics per milliliter. And so if your epi dose is 2 to 10 mics a minute, you can give 1 milliliter. So I'll put it on their IV and I'll push 1 milliliter and back off of it. That will give, and flush it in, that will give me some instant blood pressure. And I can do that every 1 minute until I get out to the ambulance to where I have my stuff to drip them. This is huge. You're going to start seeing this a lot more with rapid sequence, I think, especially if you're using succinylcholine.